I'm 11 Alive investigator Rebecca Lindstrom. For years, 11 Alive Investigates has raised awareness about gaps in our behavioral and mental health care system. Gaps that cost taxpayers money in repeated, intensive, and often inappropriate care. It is a complex problem with, as you'll see, many perspectives on what we should do about it.
He went after the kids.
I'll take your son to the taxi. He's trying to attack me right now.
And I finally cornered him by the kitchen, blocked him, and I said, run, run.
I have a glass pantry, and he punched it and broke it.
He started screaming, ah! And then he slammed his hand into this glass. He had blood running down his elbows, glass was everywhere.
Want to get in? No. Here you go, AJ.
As Tanika Clark's oldest son left in an ambulance, she made a decision.
We have a 19-year-old autistic kid here.
She wasn't going to follow that ambulance or pick him up from the hospital.
We've been waiting on the mother to pick him up since 1 p.m. yesterday.
Oh, the door is from him. Pow! I mean, it sounds like gunshots when he does it. It's loud.
Tanika Clark says AJ threatens the safety of her 2 other children.
Imagine you see somebody, a woman being abused, you're like, you need to leave him, you know? This is my son, though. This is different. He's literally attacking us physically.
911, what's the address of the emergency?
The 911 call, the last time I heard that they were locked in the bathrooms, terrified.
Imagining what I think is happening out there.
We're really fast
I'm fastest, so I would always get to the safe places first.
But you had to have safe places.
Yeah, we have like a bathroom because he would always
the door for the bathroom is really strong.
How would you feel if you knew your brother was coming back?
If you bring him back, then I'll just be depressed again, and then
I'm mild about it because I really don't know. Because I love him, but I just don't like the fact that he not really ruined our life, but did all this bad stuff. Ready?
Hey.
AJ's brothers say they used to enjoy playing with him, but as he got older, his behaviors changed.
The reason why 5 is my favorite number is because when I was 5 years old, that was when nothing bad happened.
I saw a room that's just filled with broken TVs.
yeah, he broke all of those.
What made him so mad?
So Mom tried to turn off the TV because she was trying to sleep, and then he got mad and he broke the TV. I mean, I actually got one time where AJ actually hurt our mom.
He was chasing me, and then
like AJ and Mom were over there. We were just looking all the way over there, and then AJ pushed him.
So this is from when the cops came.
AJ, what's going on? You all right?
Tanika Clark has called 911 in Roswell a dozen times in just 1 year.
We're going in a circle, you're doing the same thing.
Roswell police declined to comment on camera about its training or response to calls like these. Public records show officers tried to help by making referrals to Adult Protective Services and calling EMS. But one metro agency was proud to talk about their effort.
We want to take an approach that's helping and not hurting.
South Fulton Police Lieutenant Nicholas Williams says every one of their officers takes crisis intervention training and a course on how to identify and relate to someone with autism. You just keep getting the same calls again and again to the same home. Right. What do?
We sit down with the family, the caretakers, the guardians, and we come up with a plan. So it's not just a one-off where we meet each other and then it's a hi and bye. We pass out our business cards, we form relationships and bonds.
Give you that, you probably have plenty with my name on there already.
But AJ's family has enough of those business cards from police in Roswell to know those relationships aren't always enough.
AJ, we gonna be good for the night? We good? Yeah, listen to your music and we're good, okay?
Police can de-escalate, but they can't fill the gaps in our healthcare system.
If you put all of the burden on police, you're setting yourself up for failure.
Taking your son or daughter to an emergency room is not the way to move a person into services.
But Alan Morgan is one of those sources, often called upon to come up with a solution when that does happen. He leads the team at the Department of Behavioral Health and Developmental Disabilities that works to connect people like AJ with services.
It's not just matching people to open beds. There's no magic facility because we don't do facilities.
Morgan says when families leave their adult children at the hospital, it can take months to determine eligibility. State funding is limited, and Georgia's workforce shortage has reduced options.
If you have, say, aggressive behavior and you have medical needs, those settings are not as abundant as we would like.
The state is building a new crisis facility in Macon and 2 transitional group homes in Augusta designed to help those that might otherwise end up trapped in the ER.
Sorry, it's just hard.
Tanika Clark says that help can't come soon enough.
I miss him so much, you have no idea.
But as much as her heart breaks, she's not picking AJ up until she can get the help she needs, the help he needs to keep everyone in the family safe.
I mean, if I was a father, I would probably miss my son. Yeah, that would be sad because, you know, he's dangerous, but you love him.
AJ spent nearly 4 months in the hospital waiting for a group home that felt equipped to take him. The state says it's tracking about 24 people every day abandoned to an emergency room because their caregivers didn't know what else to do. Emergency rooms aren't built for long-term care. That's why Maria Manning is so confused. Her son sat in this ER for 2 months.
That's equivalent to just being in the airport, trying to get on an airplane for 2 months.
Jalen sat in limbo because he didn't need surgery. He needed mental health care. But Jalen is an adult with autism and developmentally disabled. Right now, the state only has the specialized staff to care for about 35 people like him in crisis.
He completely ripped the banisters off.
In November, Jalen had a dangerous and destructive breakdown.
Everything was here, like in the space, like the banister pieces, the big mirror, the broken glass.
That's when she decided no more. After paramedics took Jalen to the ER, she refused to pick him up. So there he waited until one of those 35 beds opened up. Maria is not alone. Just listen to what Piedmont Healthcare told a legislative study committee.
So we absolutely are having patients that do hit 100+ days sitting in our emergency rooms or on our medical floor bed. This is a daily situation.
Grady Hospital told the committee it's not just a Piedmont thing.
It looks like we're seeing almost about 10 times the amount of patients within the Atlanta area within our emergency department.
Federal data shows more than half of those people have no insurance or rely on Medicaid. And they are the ones getting stuck. Piedmont's solution?
The only way to get them there is for us to pay for it.
In their presentation, Piedmont says it spent $3 million to get patients out of its ER. Despite repeated requests, neither hospital would talk with us. So we sat down with Aviva Berman, who also presented to the committee. Berman is with the Atlanta Regional Collaborative for Health Improvement, or ARCHI. It meets with hospitals across the metro to figure out how to help. She told lawmakers, we need a structural solution. What do you mean by a structural solution?
I don't think I can dive into that.
So why is it that you guys can talk about this in a legislative committee and say all of this to people there, but you can't say it?
Yeah, I mean, what we hope for is for more services and programs and crisis and respite beds.
Beds that can help people like Jalen get the care they need without having to wait months and taking up space in the ER to get it.
I'm gonna fight with every breath I have to make sure he gets what he needs.
Lawmakers did increase funding to help another 250 families in need of services, but the needs far exceed the resources, even for those families who want their adult children to stay at home.
No, I don't want a baby. Here, come here, guy. What are you trying to get her to put something on your phone for you?
Would you be okay backing up?
Come here, buddy. Come here, mama. Come stand beside mama.
What happens if you don't take it?
Here, shove it in your face until you do.
It's hard to carry a conversation with Gabe around. You can ignore movement and mumbling. But Gabe demands attention.
Have a charging cable. This is good. Come stand beside Mama.
Gabe was diagnosed with autism as a toddler. His mom, Erin, says the family had a routine to support his developmental disability, but they were not prepared when 5 years ago, a doctor diagnosed him with schizoaffective disorder.
It's like he just woke up and he was gone.
Gabe no longer has boundaries. It's one thing to keep handing someone stuffed animals and cars, but he has also become fixated with things like the stove. Erin says it is hard to get people to understand.
They're like, it can't be that bad. It can. It really can. It's like his impulse control is gone. I stopped at the gas station. He got out of the car and ran.
Georgia has what's called a service waiver to help families afford care for people like Gabe.
It'll pay for the day program. It will pay for nurses to come help take care of him. It should pay for behavioral health in the house. Supposedly it'll pay to fence in our yard because he's a runner.
But there's a cap on how many it can serve. Darcy Robb, the executive director of Georgia Council on Developmental Disabilities, says there are 7,000 people on that wait list. People like Gabe.
The question they've been asked, is the person currently homeless? So I think that gives you a sense of how bad things need to be before a person gets a waiver.
Lawmakers are debating whether to raise that cap, but the current proposal would still only help about 5% of those people. But waivers won't mean much if there are no workers to do the job. Right now, the pay for these support services is on average $10.63 an hour. According to the job site Indeed, you can make more with an entry-level job at a grocery store, fast food chain, or movie theater.
But even the people who desperately want to do this work, they're coming back and saying, look, I love this work, but it's just not enough to sustain my life. Literally, they can't pay their bills.
A study on wages in Georgia led the state to recommend boosting pay for direct service providers by more than 40%. But a bump to $15 an hour would cost state taxpayers more than $90 million a year.
When we don't invest in this population, we get a lot of crisis and chaos.
That's when he was actually in the psych room.
Erin remembers the last time she tried to get help. She went to the emergency room.
I asked them what would happen if I signed over my rights to the state. And they said they'd get me for abandonment. I'd go to jail.
But she counters with her own question.
How is it not criminal for him just to be pushed away?
What did you break here?
The ER knew it didn't have what Gabe needed, so it did try to find him mental health care.
I mean, they literally said we tried every single place that we know of in the state of Georgia, Florida, surrounding states. They said we can't find anywhere.
And a big reason for that is he can't do things like bathe himself or cut his food. It goes back to having enough staff.
Do you feel trapped?
Oh yes, of course.
Trapped because without treatment and in-home support, Erin had to quit her job. For a while, her husband lost his, and the other kids struggle with school. They worry each month how to make the mortgage. And for it all, Gabe is still not getting what he needs.
Well, what you see is him walking and talking, but what you don't see is him getting naked and kicking holes in the walls and running outdoors and screaming that there's aliens getting him. One day, last week, he cried all day, all day, like this uncontrollable.
And that is when Erin cries too.
I cry a lot, I do, and you know, I try not to do it in front of my kids. Go to the bathroom and cry. So, but yeah, it's hard.
There are other stories like Gabe's, AJ's, and Jalen's. I have been following how the state is addressing these in our behavioral and mental health care system and potential solutions. You can hear from more families by going to 11alive.com/keeping.